A 60-year-old man who was coal miner for more than 15 years presents with cough for past 6 years and new shortness of breath for past 4 months. His cold is dry, his cough is dry and persistent, and his dyspnea is exacerbated by physical activity. He admits that he did not take any safety measures when working in mines. His vitals are normal except respiratory rate, which is increased. Breath sounds are decreased on both sides. X-ray shows interstitial fibrosis with reticulonodular infiltrate bilaterally. Which of the following is most likely diagnosis? Coal workers pneumoconiosis, Kaplan syndrome, talcosis, asbestosis, or bronchogenic carcinoma. So basically, what is pneumoconiosis? So for pneumoconiosis, you're supposed to remember very few conditions, which I'll just write here and help you to give certain distinguishing point, and you just need to remember that much only. So here the answer is coal worker pneumoconiosis. So for coal worker pneumoconiosis, you need to remember that the person is going to work in mines. As this patient is working, is going to work in mines. So if you do an X-ray, what you will see is there are small nodules in the upper part of lung. This is the initial presentation. Small nodules in the upper part of lung. Okay, upper part. And other than that, once there is some time has passed, then these small nodules are going to coalesce and form cavities and more of a cavitatory lesion in the upper part commonly. This is coal worker pneumoconiosis. Next important pneumoconiosis is asbestosis. Okay. So what asbestosis cause? Asbestosis is only in, like, there can be other pneumoconiosis that involve lower lung, but an important one to remember is asbestosis. Asbestosis causes lower lung issues. Again, it is going to cause some nodules and fibrosis, but in lower lung. Okay. And other than that, what you're going to see is pleural plaques. So basically, let me show you pleural plaques. It's very important. I'm not sure if you can see that. Let me try to. If you can see this white lines, this is pleural plaque. So basically, in pleura there is formation of plaque, and that is seen in asbestosis. This is X-ray image. This one is a very common figure. So what they have done is that they have removed the lung, and this is below the base of lung, and these round these are pleural plaques. These are present on pleura. This is a commonly shown figure in exam, and there will be some kind of question relevant to asbestosis in the exam, so you should be able to distinguish. And then I also showed you an X-ray of pleural plaque. So we were on asbestosis. I had to erase my beautiful figure, but I'll put point again. We were on asbestosis. Asbestosis, you will find the infiltrate in lower part of lung, and you will also find pleural plaque. Okay. Apart from this, an important point is asbestosis is cause of mesothelioma. Mesothelioma is basically cancer of pleura. So since it is causing pleural plaque, it is going to cause cancer of pleura, mesothelioma. It also causes bronchogenic carcinoma. And always remember, this is a confusing point that is usually trigged on bronchogen. Although only condition, very few conditions cause mesothelioma, and one of them is asbestosis. Lot of conditions cause bronchogenic carcinoma. One of them is asbestosis. But even in asbestosis, you are more likely to get bronchogenic carcinoma than mesothelial carcinoma. So how they try to trick you in the exam is that they will give you a picture of asbestosis or a presentation of asbestosis, and they'll ask which of the following cancer is most likely to occur. And since we remember that usually asbestosis cause mesothelioma, we quickly go and mark that as answer. But most commonly, if it's most likely to cause, it's going to be bronchogenic carcinoma. You should remember this difference. I hope this is clear. So we covered coal workers pneumoconiasis, we covered asbestosis. Another important one is silicosis. So silicosis presents very similar to um, coal worker pneumoconiasis. It will show upper lung infiltrate. Later, it will go ahead and form cavitatory lesions. It also includes mediastinum. An important distinguishing or pathognomic point is it is going to show eggshell calcification. So basically, whichever area it involves and forms this cavity, there would be certain amount of calcification in the cavity, and that is going to present as eggshell calcification. In silicosis, it is very important to remember that it increases the risk of TB. So basically, what silica does is silica interferes with macrophage and formation of granuloma. And in that case, it becomes very difficult to fight with TB if you can't form granuloma, and therefore there is an increased chance of getting granuloma. So to quickly revise, coloworkers pneumoconiosis, you are going to see upper lung nodules and cavity in a patient who works in coal mine. In asbestosis, you are going to see lower lung nodules and cavity, lung plaque, mesothelioma, bronchogenic carcinoma. In silicosis, you are going to again see upper lung nodules and cavity, but there is also going to be eggshell calcification. And silicosis increases the risk of TB. Now, what is Kaplan syndrome? So basically, if there is coal workers pneumoconiosis plus rheumatoid arthritis, this together is called Kaplan syndrome. But in our case, this patient did not complain anything that was related to joints or things like that. So that is not Kaplan syndrome. If this same patient would have been given in the question and they would have said that he's having these knee pain, symmetric knee pain in the morning, which is more in the morning, and all any feature that has been pointing towards a rheumatoid arthritis, in that case, we would have gone ahead and marked as Kaplan syndrome.
Thanks for watching. Please give a thumbs up and subscribe for more.